Hi, my name is Heather Cole and I'm a physical therapist assistant at OSC Physical Therapy Center. I'd like to talk to you today about the importance of scapular mobility or shoulder blade mobility in rehab for the shoulder. When we think about the shoulder, we tend to think of only where our arm attaches to our body, but the shoulder in itself is actually a complex of 4 joints. I have a model here to show. So we have 4 joints where the arm attaches to the body. We have where the collarbone attaches to the sternum, where the collarbone attaches to the shoulder blade, and where the shoulder blade attaches to the body or the rib cage. Now it's very important that all 4 of these joints move well together in order to allow maximum potential for strength and for motion of the shoulder. You can't have movement here without the corresponding movement everywhere else. The shoulder blade is actually responsible for about 1/3 of the range of motion in your shoulder. So when you think about that, if we have 180 degrees of flexion in a normal shoulder that goes all the way up, without the shoulder blade, you would stop at about 120 degrees, and that's all you would get. So it's very important that that shoulder blade glides and moves the way that it needs to in order to maximize the potential for rehab. Okay, so my model Hunter here, who's one of our techs, is going to give us some examples of what the shoulder blade should do versus what it shouldn't. Now when you have a shoulder that is not moving well, what tends to happen is as the arm comes up, the shoulder blade also rises. And that's not what we want to happen, because you're not truly getting motion from the shoulder joint itself, you're getting compensation from this muscle right here, which will become dysfunctional and painful. What should happen is as the shoulder blade comes, or as the arm comes up, the shoulder blade should depress and slide down the rib cage, sort of in a downward, inward motion. And that allows full motion of the shoulder. Now, when we bring it up and this muscle is overactive, this doesn't actually move. This moves, and you're not really increasing the actual movement of the shoulder joint. So it's important in shoulder rehab to work on several motions. You want to work on squeezing the shoulder blade down for increased flexion, or bringing the arm straight forward in front of the body. And if you're bringing the arm out to the side, you want to work on the shoulder blade rotating out away from the body just slightly. So if you'll watch, my hand is right over his shoulder blade. As he moves, we rotate just slightly. Increased activity through this muscle can cause a lot of pain and discomfort, and also imbalance in the way that the shoulder moves. So the more you use your compensation and hike the shoulder blade, the more that is going to strengthen that reaction and continue to limit true motion of the shoulder. It's important to talk to your therapist or physician on whether scapular mobility is an important part of your shoulder rehab. Please ask at your next visit and make sure that you work on the basics of depressing and slightly rotating your shoulder blade as an exercise program to continue with your progress.